Very much. We have a question over here.
I'd like to ask Governor Clinton, do you attribute the rising costs of health care to the medical profession itself, or do you think the problem lies elsewhere? And what specific proposals do you have to tackle this problem?
I've had more people talk to me about their health care problems, I guess, than anything else. All across America, you know, people who've lost their jobs, lost their businesses, had to give up their jobs because of sick children. And so let me try to answer you in this way. Let's start with a premise. We spend 30% more of our income than any nation on earth on health care, and yet we insure fewer people. We have 35 million people without any insurance at all, and I see them all the time. 100,000 Americans a month have lost their health insurance just in the last 4 years. So if you analyze where we're out of line with other countries, you come up with the following conclusions. Number one, we spend at least $60 billion a year on insurance, administrative costs, bureaucracy, and government regulation that wouldn't be spent in any other nation. So we have to have, in my judgment, a drastic simplification of the basic health insurance policies of this country. Be very comprehensive for everybody. Employers would cover their employees, government would cover the unemployed. Number two, I think you have to take on specifically the insurance companies and require them to make some significant change in the way they rate people into big community pools. I think you have to tell the pharmaceutical companies they can't keep raising drug prices at 3 times the rate of inflation. I think you have to take on medical fraud. I think you have to help doctors stop practicing defensive medicine. I've recommended that our doctors be given a set of national practice guidelines, and that if they follow those guidelines, that raises the presumption that they didn't do anything wrong. I think you have to have a system of primary and preventive clinics in our inner cities and our rural areas so people can have access to health care. But the key is to control the cost and maintain the quality. To do that, you need a system of managed competition where all of us are covered in big groups and we can choose our doctors and our hospitals across a wide range, but there is an incentive to control costs. And I think there has to be, I think Mr. Perot and I agree on this, there has to be a national commission of healthcare providers and healthcare consumers that sets ceilings to keep health costs in line with inflation plus population growth. Now let me say, some people say we can't do this, but Hawaii does it. They cover 98% of their people, and their insurance premiums are much cheaper than the rest of America, and so does Rochester, New York. They now have a plan to cover everybody, and their premiums are 2/3 the rest of the country. This is very important. It's a big human problem and a devastating economic problem for America, and I'm going to send a plan to do this within the first 100 days of my presidency. It's terribly important.